Welcome back to Inclusion Revolution. I'm your host, Tova Sherman, and we're finishing up our wonderful visit with Dr. Ahmed, a true leading researcher and developer and creator of programming for persons living with ADHD and that spectrum. And doctor, you know, we talked a little bit about, I know we don't have enough time and I feel terrible, but we've talked a little bit about the medication, the approach, the importance.
Yes.
I think you and I both agree to be taking medication, you should also be seeing a doctor because things change so dramatically.
Exactly.
And I meet a lot of clients, doctor, that don't have the advantage of you as their doctor, and they have seen a doctor once a year, and you know, the medications go. But what I wanted to talk about, and something that I'm very dedicated to, is the whole idea of holistic approaches. I'm not negating the importance in any way of medication and therapy, but can we talk about some of the other things you recommend for both young and adult people with ADHD to manage better?
Okay, our spectrum of management includes all of these things. The most important thing that we talk about is behavior modification and development of interpersonal skills. Okay, and then we also talk about relaxation therapies, yoga, exercise, basic needs of eating right, sleeping well. You know, we cannot abuse our body. Most ADDs have problem with insomnia. They're up till 2, 3 in the morning, then it's difficult to get up for school. So we teach them how to unlearn learned behaviors, which is modification of behavior. You teach them time management, you teach them visual cues, you teach them auditory cues, you teach them organizational skills. And one should start from basics and try and see how much your patient is accommodating and learning to these changes.
Be open to really doing it.
Medication is only 1/6 of the whole spectrum. Other things include awareness of the condition and how to cope with it. So if we need an occupational therapist to help me write and learn to write, I will ask for that. If I need a physiotherapist because my posture is inappropriate, I will ask for that. If I need a psychologist to help my child learn how to control anger or impulsivity, I should do that. I think the important thing in managing ADD is the liaison with different disciplines. A teacher, a therapist, a counselor, an employment counselor.
A team approach.
A team approach, which is what's important. I think ADD cannot be targeted as just medication. That is not fair. ADD is a comprehensive approach, a comprehensive integrated treatment plan where all of these different specialties are involved in managing, and the success rate is very high.
But I have to say this, Dr. Ahmed, because in Nova Scotia, as in many places across Canada, there's always concerns about the access to this kind of support. And I love what you're saying, and of course I agree completely, and the whole concept of inclusion is having this holistic approach to your life and balancing it in a way and equalizing the playing field so that you're able to just be like everybody else, but be yourself, which is what we all want everyone to be. It's no different. But the truth is, and I myself, who lives with ADHD, has seen this in my own experience, is the attempt to get everyone to work together. And that is approach to holistic.
That is a major challenge. But what I would say that the least that we can do, okay, is at least follow through. It is important, because the downside of not managing ADD, whichever way you want, okay, it should always be a patient-directed approach. In my clinic, I say to the patient, what would you like me to do? There are 6 things. This is a global treatment plan. Where do you want me to start? Because I want success. I don't want failures. I don't want taxpayers' money wasted on adolescents and adults being in the East Coast Forensic Unit. I'd rather have them active,
of course,
successful, right? So I know it's time-consuming and it's hard work for the parent, but that is the direction. I think continuity of management and support and positive reinforcement is very important.
Absolutely. And one of the things that I have to honor you with, and that is the fact that I've worked with a few of your clients, and every one of those clients are so incredibly connected to you. Do you not also have a camp?
Yes, we do, ma'am.
I mean, you're really holistic. I don't have much time, but can you tell me a little bit about that camp?
We run camps every year, and we go for a week. away to Windsor, Nova Scotia, where the Department of National Defense facilities available to us. We have about 40 kids in the camp. We have trained counselors. We stay there a whole week. We teach kids how to exercise, how to breathe fresh air, how to eat the right food, how not to use chemicals, what are the benefits of not smoking and doing drugs. And we have age groups from 5 to 18.
Fantastic.
And they really enjoy the camp.
So you're not just talking the talk, doctor, you're definitely walking the walk, as we say.
And we do support groups for children and adults.
Well, I've just, having met some of your clients and some of the challenges they face, I have to give a lot of credit to you, Dr. Ahmed, because you really are, as I say, taking that holistic approach, and it's not something we always see, and I want to honor you for that. Now, at the end of our show every day, before I say thank you, I read a little bit of a poll and a little news. So let's see what you think of the news, because it is about ADHD. Sure. Could be from you. I don't know, one of your research pieces. The news today is 5 tips for adults living with ADHD to help them get organized, and this source is WebMD. So tell me what you think. Number 1, to create a family calendar. Number 2, to clean out the clutter. Number 3, to label your life. Number 4, to use to-do lists. And number 5, to take time.
Absolutely.
Sounds good. Totally. I've got the okay from Dr. Ahmed. And our poll this week is, do you think ADHD is often misdiagnosed and too often? And that's really all the time we have today. Thank you, Dr. Ahmed.
You're welcome.
And from Eastlink TV and Inclusion Revolution, I thank you for joining us, and we look forward to seeing you next week, every Sunday night at 8:30 and Monday to Friday at 3. Hope you'll be there.